Okay, let's say that, so the story was in this bad drama situation. Jackie's our colleague, she's a camerawoman. There was an explosion. There was some fighting between rebels and government forces. There was some shooting going out, some rockets, there was some homemade rockets coming in, some more shooting. Okay. Anyway, there was an explosion, Jackie's injured, we come out here and it's safe. Okay, so we're not in any danger. But obviously that was what you were all thinking about. Yes. So let's go in and see what's going on. What can we do early on? We've done danger.
Danger, yeah.
What comes next?
Response.
Okay.
Jackie.
Hello.
Jackie.
Yeah. Okay.
Okay, so she's responded that she's okay?
No.
No? Why not?
No, check for
The breathing.
Okay,
Bleeding.
okay, right. So
With
we,
white blood.
okay.
What kind of white
Right,
stuff?
just gathering an arc here because we're going to be here in a while.
Can you hear us?
Okay,
What happened?
so there's an explosion. What happened? There's an explosion? She doesn't know. Sometimes things go bang, there's gunfire, people get injured, and like the medic in the back of the ambulance, he probably didn't actually know what was wrong with him, he just knows he doesn't feel very well. So we talked about danger, that's done. Response, she's responding.
Yes.
Is she good?
No.
So what I want you to do is not think, just because they're responding, she's okay, we can get, forget about her. She's responding, but she's not good, she's restless, looks like she's struggling to breathe. So we still need to then think about the rest of our list. Is there any signs of catastrophic bleeding?
No.
No. Okay, so what comes on our list now?
Airway.
Airway, which we know she's got an airway because she's up, she's conscious. So after airway,
Chest.
breathing.
Chest.
So she is breathing.
She's breathing.
She's breathing,
Normally.
but it doesn't just mean is she or not. If we don't know, we need to check
Yes.
yes or no, maybe CPR. But if she is breathing, we still need to assess the breathing. How is she breathing? The medic in that ambulance was breathing. Does that mean he's okay?
No.
No. So this is where we need to be a bit more thorough.
But let's exclude CPR for her. There's no need.
Yeah,
for
no
CPR.
CPR because she is breathing.
Somehow she's.
Fortunately, she's wearing body armour, so she's okay. Yeah, she's all right under her body armour.
No, not necessarily.
Maybe from her back or from her
What if it's going like this?
from the
Okay.
middle,
Yeah,
looks like
Good.
something,
check.
or neck, or the neck.
So remember, body armour. It's a plate. It protects your vital organs, your heart and your lungs mainly. And the killing zones with body armour are down the sides, around the neck. Even with this isn't actually bulletproof. And in the groin. Remember, we've got this major blood vessel in our groin, so that plate doesn't cover it. So we still need to check. Should we take the body armour off?
Should we take it off? Yeah, because
What if she's badly injured and it's holding her together?
No
Well,
matter.
we need to check what is inside.
Yeah.
yeah.
If
And it's difficult for her because
Yeah,
it's,
it's probably harder
yes.
for her.
Yeah.
So two things. It's heavy. It may be making breathing harder for them. Also, if the body armour, because some people say no, like a crash helmet or body armour, it's holding them together. If that's the case, they're really, really ill, and we definitely need to see what's underneath. So we're going to take it off. The point is also for you, if you're wearing body armour, you're using it, there are different models. This is a fairly new model, but there are some others. Just know how they come on and off. This set's actually quite good. Undoes at the sides. You've got this double velcro on the shoulders. Okay, same on this side. We need to get that off. Okay, and then there's
will
more.
help you.
It's okay. So we need to know this comes off and how to take it off. So what comes next then? So we've got that off. That's going to maybe ease a little bit. What if there was still gunfire going on? Would we have done that?
If it is gunfire, we will ask her from there. Are you okay? Are you fine? Can
If there was gunfire up at these rebels up here,
Yeah,
and these people, we're not going to be here.
No.
Hopefully, she
No.
will crawl around that
Yeah.
side of the wall or get protected from whoever's shooting, or we get in cover. Did you see the video already? The crossfire on the
Yeah, on the road.
crossroads.
Yeah.
Yeah. So basically, if it's not safe, you don't go out there. People, I'll run out and drag them in, but you're putting yourself in danger. You need to wait till the danger's eliminated. So, if there's still gunfire going on, we're not going to be doing it. What we are going to do is find out, we know particularly because of the type of the injury, the gunfire, the shooting, that there could be a chance of injury. Scissors. So we've got zip layers. Now we noticed Jackie's struggling to breathe. We mentioned this, so I'm worried about chest injuries. One good way to actually assess the breathing is to ask them a very simple thing. And obviously I'm talking to you, this whole time I'd be talking to her. But I would say, Jackie, I want you to take one breath and then count to 10 in one go for me. Okay, go. Okay, do we need to ask her to do it anymore? No, she should be able to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay,
well,
but she can't even make it to 3 or 4, so there's no point. She's obviously struggling to breathe. So we need to get to chest. So we can unzip. Okay, obviously things like this. Should we cut her t-shirt?
Yeah. Let's do the full
Go
one.
for it.
Yeah.
Okay, you sure? They said yes, Jackie. It wasn't my choice. Okay, and there we have a sucking chest wound. Okay, everybody's favourite. So, this kind of injury, do we know much about this? Can you hear that sound?
yeah. Squashed.
What's going on?
Blood in lung.
What's going on inside?
It's lung.
Lung, they are just.
Yeah.
Okay.
A lung.
It's very, very dangerous.
Yes, that's all we need to know. But actually, I'll just explain what's happening because we've got a piece of kit to deal with that specifically. So if I explain the injury, we'll understand it. But like I said, when you deal with it, you treat what you've got there in front of you. Okay? So, inside your chest, you've got flesh on the outside, then you've got your rib cage, then you've got your chest cavity inside there. You've got your lungs, but between your lungs and the chest cavity, or between the chest wall, there's a cavity, there's a space. Now, an outside object like this bullet or piece of shrapnel, we don't know what it is, it doesn't really matter. The same as that medic in the video, has come in from the side, because the body armour covered here, so it's entered from the side, and it's made a hole through these different layers and possibly gone into the lung. But basically now there's a gap from outside air into that space, the cavity, but also air from the lung itself can escape into that cavity. So now what's happening is that little tiny space is filling up with air. Now your chest won't expand outwards to make room for it. So what happens?
You
The
can't feel
lung,
you can't
the
get
lung
air.
collapses, and this is what they condition a collapsed lung. When you get this build-up of pressure in there, it's called a tension pneumothorax, but it doesn't matter. It just means there's tension, air tension in the thorax. So you've got this air pocket building up. It means Jackie, when she tries to breathe in, her lung won't expand because there's pressure inside there, so she won't get a good breath. But what does happen is when she breathes out, as her lungs compress for the air to come out, air from outside, as the air pressure in, because inside our bodies we're like a negative pressure. So air from outside, which is positive, will go into that hole. So more air will be coming into that hole, and when she tries to breathe, air from inside the lung will also go into that hole.
How quick does this happen?
Well, that medic in the video,
How quick do you lose your lung capacity?
within a few minutes you'll be struggling to breathe. So the guy in the video earlier, there was the explosion, he got up, he ran to the ambulance, got in the back, then he starts feeling faint.
3-4 minutes.
He doesn't have so much oxygen, and then over a period of time, 10 minutes, depending on the actual injury, maybe 20 minutes.
But that's one
You
lung,
cannot
right?
breathe
We've got a
with one
second
lung.
one.
We have.
People known to live with one lung.
Yes, however, in this case, I don't want to get too medical with it all because we won't know a lot of this. As this lung collapses and the air pressure pushes down on it, the lung collapses, sits on the heart. So the heart's now struggling to breathe, but also that pushes the heart across. So this is now just a big empty void, or filled with air, but no lung, and it all squashes across, and the heart pushes this way, and now this lung can't move properly either. Now you might see what we call a deviated windpipe, where if you look at the casualty, the windpipe here is actually moved across like that because all this has moved over, so it's over there. However, from outside, how much of that can we see?
Nothing.
Nothing, but we've got a hole and it's sucking, so it's a sucking chest wound. Okay, so our main aim at this early stage is to stop more air going in that hole. How can we do that?
Just put something.
Yeah.
What have you got
Yeah,
that
I know.
would cover that hole and stop air going in that hole?
The finger.
Okay, and
You
now,
can use, you can use Jackie's finger.
yeah, now
Stop 10.
there's no air. If you listen, the wound has stopped, there's no sucking, because there's no air passing in and out of that hole. Okay, if you take your finger away, it will start again. But Jackie's conscious, because I obviously need to get stuff out of my med kit. I need my hands for that. So I can get Jackie, so give me a hand, and say, look, can you put pressure on there for me? Okay, I'm not going to say to her, look, you've got a hole in your lung, air's getting in there, if we don't treat this you're going to die. But I'm going to say to her, look, you need to cover this hole, I'm going to help you. So be positive, tell her nice happy things, you're going to go home, don't worry. So now I've got hands free, I can go to my med kit. In your med kits you have, you all know obviously these are in your med kits because you check them regularly.
Yeah, we have.
Yeah? What do you mean no?
We have.
Sergey knows.
Yeah,
but
yeah.
you all recognise these.
That's a part of a large kit, not a small one.
Okay,
And that's a large kit, right?
yes. This is a team kit. In here, there's actually in the packet, I'll just show you. There's a piece of absorbent gauze so I could wipe away any blood. Okay? But these wounds don't necessarily bleed that badly. If you remember that video this morning, even a few minutes in, the guy in the white shirt, he only has a little
tiny.
blood spot. There's no major blood vessels there. It's not going to be spraying out blood. It's literally just through making a hole in the skin. So it's nothing too bad. Plus the bullet or the object's gone inwards and it drags everything in. So nothing to see there much. Now this is called a chest seal. What do you think it does?
Seals the chest.
Raken.
Just to normalize.
Yeah, it seals the chest. That was my little joke, but don't worry. Okay, it's basically a very, very sticky thing. Okay, we use this a lot for training, and it's still
Club.
really
Get
sticky.
the club.
When they're brand new, if you sort of literally put your hands on it too much, you
What about men? It's
Hairy
like-
men?
Yeah.
It's
hairy.
okay.
You shave them first. You take them to the barber.
they've actually, the people that make these have, within the last 6 months, have upgraded the stickiness, and they're now marketed as being aggressively sticky, purely for the fact. Where do you think these are used most? Chest. Yeah, war zones. Yeah, on the chest, but in war zones. So majority of people getting shot or injured are going to be male. A fair percentage of males are hairy, so they've decided rather than these sort of sticking on this layer of fur that some people have, that actually it's so sticky if you just press it, it will still get through and stick to the skin. So it will be fine, don't worry. So we basically take the back off, and you'll notice there's this central circle. The hole in the chest needs to be behind that central circle. There's these little valves, I'll explain those in a minute. It doesn't need to be, the hole there doesn't need to be directly behind these, it just needs to be in the middle somewhere. Okay?
So it doesn't matter really, yeah?
No, it doesn't matter. So then we go 1, 2, 3, stick, stick. Okay. So now, what happens with this chest seal, as Jackie, say she's breathing out, the lungs compress. The pressure inside the chest drops, which is normally what draws air to come in. But the little rubber valves that sit in there, they're sort of little flexible rubber discs. So as the pressure drops, they suck down and they seal the hole.
Yeah.
All three of them. As she then pulls her diaphragm down, her lungs expand as the chest pushes. If the lung is trying to expand, where some air might be going into that little space, it actually, because there's a pressure in there, those little valves lift off their seat and air can escape. And then, so those little valves stuck down, let air out. Suck down, let air out.
Why not just have the whole thing?
If we just seal the hole,
Yeah.
i.e. as we did with our finger, we stop air going in. But what about the air?
But she's breathing.
Yeah, she's breathing, but the pressure, the problem isn't just her breathing difficulty, it's also the fact that her lung is now compressed because of this build-up of pressure. So stopping air going in is phase one,
So we need
to stop it getting worse. So short of actually getting a needle, it's called a needle decompression, we get a needle, you stick it into her chest cavity and then draw the air out, if you want to have a go at that. Or we can just use this, which is probably better.
So the regular work of the lungs will eventually push this abnormal
Yes.
air out.
So as the lungs expand, where the pressure was building up,
It will
it
start.
will allow some air to escape through this valve, but without allowing any more air to come back in. Does that make sense?
Yes.
Alright, I don't want to get any more in depth about it than that, because we just see a hole in someone's chest, they're struggling to breathe,
Well,
stick a sticker on it.
if we don't have the sticker.
Okay,
Would you
if
please
you
tell
don't
us?
have a
Yeah.
sticker, we used our finger to start with, or their finger, in which case we get something else sticky and stick it on there. So you will have in your med kits tape. I would suggest you put some duct tape, gaffer tape, in your med kit. You could get some of this, stick it over the hole, or somewhere in here. If you happen to have the wrapper, so if you've got dressings or bandages in there, take them out, get yourself a piece of plastic, and we could make one of those dressings.
Can I put the plastic and then over?
Три, нет, только три стороны.
Три
надо
стороны,
будет,
да, не, чтобы клапан получился.
So we make a little thing. Hold on a second. Now, anybody who did any training years ago might have been told only stick 3 sides,
Yeah.
because the idea being that the loose side would be the side that goes over the hole
It will work like a valve.
and would let some air out. However,
Now it changed.
now it's changed, and we would stick that whole thing. Let's have that off there a sec.
But then it would start pushing. It will
Okay.
rip the whole thing away because of the. air.
So if we don't have this, we would make that valve, stick that on there, okay, and stick it on, and make sure it's stuck down all the way around, so really press it on. The idea they used to say was to leave one side without tape so that the plastic can suck down and lift off, but it doesn't work as well as they like to think it does. It's not a purpose-built valve. So all that happened is, rather than the person getting better, they got worse.
It's very hard to really mount this thing on the uneven, sweaty, no offense, dirty body. So I mean, wouldn't that be safer just to keep them stick the finger on and transport them like this?
But they're
Or better
depending on
still,
their condition.
have them coordinated, breathe out.
You can't. No,
Take
you
the
can't do
finger
that.
out?
No,
No?
ignore that. That doesn't work. Gaffer tape. That's why we say gaffer tape, because it's so sticky. If you find one hole, look for more. Okay, we found that. Yes, we've treated it, but what's the likelihood? All this shooting. Was there only one bullet flying around that maybe hit her? There was an explosion. Was there just one bit of shrapnel that found that body? There's probably going to be more, so we're going to assume there's more. This is also why the size of that hole, are you going to see that on anyone else? Remember, that medic was up and running around, so there's been an explosion, you're running with your colleagues, they go down the ground. Are you going to see that little tiny hole through this clothing?
No.
So this is why we need to cut, rip, tear, unzip and get down to skin. Had surgery for years to get all this stuff to understand it. All we need to know is that there's a hole in the chest, we don't want air going in there. If we can get air out, that's better. Okay, so this is how we do it. Chest seals you've got in your team kits, which you should have with you, not just sitting in the office or in the car.
How many per kit?
There's one in there, one per kit.
'Cause I was thinking there's a likelihood that there's an entry.
Yep, if
an
there's
exit.
possibly an exit, so then we maybe have to improvise the other one. That's the way it goes. However, if you find one hole, look for more. So we're going to make sure we go all the way down Jackie's back. We're going to rip this, get all the way around, come underneath, and check the same as we did laying on the floor. Get your hands in
It's not bullets, it's
and
just
find any other holes. If you find an exit hole, obviously the entry hole might be small, the exit wound might be bigger, but potentially that big wound may not cause a sucking chest wound because there's a big hole. There's nowhere for the pressure to build up because the chest is now open, so there is no pressure. Obviously it's not good, they're probably still going to die, but it's not going to be like this sort of build up of pressure. So if you imagine a pressurized container like an aerosol can, make a little hole, you get this pressure leak. If you just chop a big hole in the can, it's just all the same, isn't it? So it's the same with your chest. But just remember, what goes up must come down, what goes in probably may come out. So it could be in, out. We had a guy on a course a couple of years ago who's been shot in the arm and it went in, out, just missed his chest. Went just skimmed his chest but didn't enter it. Went through the car seat into somebody sat behind him in their knee. But had his arm been there, could have been in, out, back in, out, and they don't necessarily travel in a straight line either. They can be ricocheting off body parts inside. We okay in the rain for a minute? Should we see if it passes? So, are we all happy with that?
Yes.
Okay.
Ну, конечно, через один клапан будет воздух.
Okay. Shall we move on?
Yes.
Okay. So also we're worrying, we said this part's protected, we've got chest, these bits are dangerous. Remember, this is still your chest, could be from the top of the back, from around the neck area where this one's entered high up, but also anything else further down on the torso. So we could maybe come up. Oh no. Intestinal wound. Let's just get that out. Okay. This kind of wound.
And she's still responsible with this kind of wound.
Has anybody here had a hernia? Do you know a hernia? Where part of your stomach lining tears and your intestine pushes out and it's underneath the skin, you get a lump.
Ну, грыжа.
Yeah? It's quite a common thing. Weightlifters get it, sometimes women when they give birth or if they have a cesarean afterwards they can have this happen. All that is, when this explosion went off, the shrapnel was flying around or maybe a bullet has gone across, not in, like that, split the skin
Or knife.
and
Yeah.
out it comes. Or knife wound, could be a stab wound, something like that, and you get this little bit of stuff comes out. It's not that uncommon, but all it is an external hernia. It's not a particularly bad, it looks horrible, she will think it's life-threatening, it looks bad, but it's actually not that bad. Obviously if we've got Jackie up, because it's more gunfire and we make her run over here, as she runs it's going to all fall out. And I think somebody said this morning in the dark room, when they went to turn Jackie over, that this could fall out. But we can just hold it. If we had to get up now because there's danger, we could literally just kind of hold that in place. It's horrible, but it's not that bad. So, should we move indoors?
Yes.
Yeah, indoor. Yeah.
You think you can walk if we help you?
Yeah, we can.
Or we could try that.
Doesn't work.
Doesn't work.
You use